Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Many times, men are coming to our clinic with severe problems with semen report or sometimes azoospermia, that is no sperm in the semen. But remember, even in that cases, you can become biological father even with azoospermia. In fact, many of our patients who are having severe sperm problem or azoospermia has become biological father. If you want to know details how, please refer to our other videos. And in our other videos, we have discussed how we go for investigations in case of severe sperm problems. We do test in stepwise manner, that is, we don't do all the tests in the same time. But before doing IVF or ICSI, we need to do genetic testing. Why? Because if there is genetic problem, there is small chance that these genetic problems may pass from father to baby, and in that case we have to take some special precautions so that your baby will not be affected by the genetic problem. Next, there are some cases of azoospermia where there is so severe genetic defect that chance of getting sperm is absolutely zero. In that case, we advise the men not to go for TESA to collect the sperms. Now, what type of genetic test we advise? First of all, we need to find out what type of problem is there which is causing severe sperm problem. If it is non-obstructive, that is when the testicles are not working, in that case we have to go for karyotype and Y chromosome microdeletion. Remember, both these tests are required. Not only karyotype, we have to do Y chromosome microdeletion as well. What is Y chromosome microdeletion? Y chromosome is a chromosome that is present only in the body of the male. It is not present in women's body. There are 4 genes like A, B, C, D in Y chromosome. If genes C and D are defective, don't worry. In that case, the chance of obtaining sperms from your body is very high. But if there is problem in A and B gene, the chance of obtaining sperms from your body is practically zero. In that case, we advise don't waste money, don't go for TESA. It's better if you can do donor sperm in that case. But remember, if A, B, C, D, all genes are normal, the chance of getting sperms is high, but that does not guarantee that we'll always get the sperms, because sometimes even when all the genes are okay, in that case, sometimes we may fail to get the sperms. Therefore, Y chromosome microdeletion will help us to know whether we should try to collect sperms from your testicle by TESA or not. Next is karyotyping. Karyotyping is important because if there is genetic problem, it can transmit from you to your baby. But remember, if there is karyotype problem, that does not mean that you cannot become biological father. Even if you are having Klinefelter syndrome, like 1 X chromosome extra, in that case also we can get some sperms from your body, but we need to take some special precaution so that the problem is not transmitted from you to your baby. How? Either we can do some special test on the sperms called sperm aneuploidy test, or we can do some special type of IVF called PGT, pre-implantation genetic testing. Now, the second type of problem causing azoospermia is obstructive. That is when the vas deferens, that is vas deferens are 2 tubes that are present from the upper side of the testis to the prostate gland. If these tubes are absent, we call it congenital bilateral absence of vas deferens. And one of the reasons for this disease causing azoospermia is cystic fibrosis. Cystic fibrosis is a lethal disease. If it affects the baby, baby will die within few years of birth. We don't want your baby to be affected by this disease. That's why if you have obstructive azoospermia because of absent vas deferens, we advise to test for cystic fibrosis by a special test called CFTR testing. We'll have another video on cystic fibrosis. You can see it to know the details. If you have further queries, please don't hesitate to contact us through our Facebook page or YouTube channel. Therefore, if you have severe sperm problem, if you want to become biological father, before going for IVF ICSI, it's important to do genetic testing. Thank you very much.